leboga re sa eme jwalo as we are still standing re kgopela gore our choir e re leade ka national anthem re bula event ye ya rena semmušo. National anthem e kgopela ka moka ba ba pereng dikuana banna ba di hlobole re eme ka moka ka setu. Re a leboga re ka dula fase. Halala Limpopo halala. Halala Limpopo halala. Re a leboga re šetše re butše ka national anthem. Ke tšee sebaka se ke dumediše mošate wa gešo wa Ga-Masemola. Bomuma bu re atamisha re dumediše le mešate e mengwe le ngona mo magareng a rena re re madume a mašweušao re tšee this opportunity to greet the Deputy President of the country, His Excellency Mr. Paul Mashatile, Premier wa rena wa Provincial Limpopo, Honorable Dr. Popi Ramathuba. Ridumedishe, our Honorable Minister of Health, Dr. Aaron Mutwaledi. In our midst, Ridumedisha Rape, the Second Lady Warina, Ms. Mashatile Balengwanafa. Let us greet the Speaker of the Legislature, Limpopo, Honorable Dr. Makurupecha, the Deputy Chief Whip, Honorable Munama, all the MPLs Balengwanafa, my colleagues, the MECs who are present here, deputy ministers, Balengonafa, the executive mayor of Sekhukhune District Municipality, Councillor Mainaba Hula, Moralia Diasabirwa, community way, Ridumedisha, our local mayor, Councillor Mera Masatri, the mayor Akamuka, Chelengonafa, our speakers, our chief whips and all councillors who are present here, Ridumedishe, the Limpopo House of Traditional and Khoisan leadership that is present here, Bohoshilibilo, Ridumedisha Rape, our Sanak Civil Society Forum Chairperson, Mr. Nduku, President of Salga, who's present here, Councillor Stofile, our Sanak CEO, present here, Private Sector, dumedisha ba sepodisa ba rena ba leng gona fa, all the DDGs and all government officials and municipal officials ba leng gona magareng a rena, members of the media, setšhaba sa Limpopo re thobela. Dumelang, abusheni, nimacheloni, lochani. Re a leboga nna leina la ka ke nna Dieketseng Mashiru, MEC wa Health mo Limpopo. Ke tla ba ke sepediša lenaneo le, a ke le sepediše ke le tee, ke na le my co-program director Dr. Khulufelo Mnyela. Re tla be re sepediša lenaneo le la rena la Lehono, re šetše re le botšeng ka go opela koša ya rena ya setšhaba. And re rata go leboga batho ka moka ba Limpopo gore ba tle ba hlakane mo ge ba kwile pitšo. Re bitšwa ke Deputy President wa rena Ntate Mashatile gore re tle mo re tle re gopole letšatši le la rena le bohlokwa-hlokwa, letšatši la World AIDS Day, under the theme ya rena e reng renewed efforts and sustainable commitments to end AIDS. Re leboga ditšhaba-tšhaba tša Limpopo gore le respondile ka moka le tletše fa go laetša gore re bona go le bohlokwa-hlokwa gore ka nnete re gopole letšatši le. Coache o tlatla a tšwela pele se nka se dirang gona bjanong gore re tlo bulela the message, the opening remarks, welcome remarks ka meyara wa rena, meyara wa Makhuduthamara local municipality, Councillor Mera Mahlase. Ke kgopela gore mo amogele a tle mo stage ba tle ba re amogele ka re a tseba gore re swanetše go amogelwa gore re tle re kgone go lokologa re keteke letšatši la Lehono. Honorable Mayor, re ka mmethela matsogo.
Thank you very much, MEC wa Health Dieketseng Mashiru. Ke go dumediše mmogo le modirišane ka wena Dr. Khulufelo Mnyela. Ge le mphile sebaka se gore ke tle ke le bee gae ke be ke le foke ka boditsi. Ke tšee madume ya go ikgetha ke iše go Deputy President of the Republic of South Africa, Honorable Paul Mashatile, the Minister of Health, Dr. Aaron Motsoaledi, and the Deputy Ministers, Baba Longona Garengarena, our Premier of Limpopo, Dr. Popi Ramatuba, the Second Lady, Me Mashatile, Mahotal Petishi Kamkaba Longona Magargarena, Speaker Rasa Legislature, Dr. Makoma Makrupeche, Member Raja Limpopo Legislature, Limpopo Provincial Chairperson of PL HIV Sector, Ms. Kensani Mavasa, President Dea Kosatu, Ms. Zingiswa Losi, SANAC Private Sector Forum, Dr. Tutula Balfo, SALCA President Councillor Begisto File, SALCA NEC member and executive mayor of Sekhukhune District Municipality, Councillor Mainaba Hula, Marunoa Mwaria wa Reka ya Sekhukhune. All mayors who are present, speakers and chief whips, Mapara Nkwe Abrena, Aeteleche Pele Deputy Chairperson ya House of Traditional Leaders, Khoshi Lebelo. Mummabu wa Morelongona, Khoshi Ga-Masemola, Mahlakwa Ngwato, Bahoma le Bahomana, ba Ga-Masemola, le ba Maragatito. Religious leaders present, senior government officials, community leaders, all distinguished guests, let's chawa kamuka, Legatong la Masepala Makhuduthamaga ke a le dumedisha. Ke re a go ikgetha madumeši ao a matshwana. Program directors, I'm delighted and privileged to be standing here on behalf of the Makhuduthamaga local municipality and its residents to extend my heartfelt welcome and greetings. After traveling through cities, provinces, and regions, let me formally reassure you that you have reached your destination. We have arrived on the royal land of Ga-Masemola under the leadership of Ga-Masemola. Deputy President, Makhuduthamaga local municipality is renowned for more than its rich and enduring history, which was shaped by our forefathers who gave their lives in defense of justice and humanity. However, we are also known for advocating women and youth emancipation through several government-led activities. In collaboration with the National Youth Development Agency, the Makhuduthamaga municipality initiated a flagship program in 2024 that resulted in the creation of the 2 million Makhuduthamaga Youth Fund. Over 50 businesses owned by youth and young women received financial boosts to revitalize their businesses and help grow the local economy. Makhuduthamaga, which receives numerous awards from the South African Local Government Association nearly annually, it is still regarded as one of Limpopo's best practice municipality in terms of financial management and governance. Despite its rural status, Makhuduthamaga continues to promote rural development by building more municipal roads and connect rural communities, in improving their livelihoods socially and economically. Moreover, the municipality has demonstrated for more than 6 years that it's trusted and capable institution for public resources management and distribution through the use of IDP and best practice. For 6 consecutive financial years, our municipality has received unqualified audit opinions, demonstrating our dedication to promote ethical and transparent local government. We are following up our audit action plan, strengthening internal controls, and putting corrective measures to finally achieve a clean audit governance. Our program directors, the Makhuduthamaga local municipality through the Sekhukhune Joint District Municipal Planning Tribunal has approved the township establishment application for the development of the Sekhukhune government offices present in the first quarter of the financial year 2025-2026. A high impact of development project led by the provincial government. I have to say that this is one of the development subjects that is close to people's hearts around the region. Most significantly, moving these offices will greatly strengthen the local economy and create jobs and increase the municipality's revenue streams. I would like to express my gratitude to the South African government, the provincial government, and the district municipality for hosting the World AIDS Day official launch in Makhuduthamaga municipality. In addition to hosting the event, this is the collaborative demonstration in support of the efforts towards HIV and AIDS treatment and testing. The Municipal Council will continue to support all government initiatives aimed at advancing access, equity, efficiency, equality, and sustainability in the provision of the healthcare through the HIV and AIDS division in the local council. Makhuduthamaga bopedi gare mabung a babina tau ba Masemola bana ba matlajwana twangkwana gore e kgolo e re ke a fofa dipofadi a gana ke a leboga mosepediši.
Thanks very much for welcoming us. Now that re welcome ilwe ra re ka dira je re tumileng ka tsona. Before ke dumedisha go ba ke lotša ke re ge re fihla Limpopo, Honorable Deputy President, re na le mokgwa o re welcomang batho ka ona. Mo Limpopo Another thing, go over program director on an advantage. Ya roka botsa batho ra re emeleng, a re duleng fase, a re emeleng, a re duleng fase. E le matlata ba filo mo wena. Ke nna Dr. KG Munyela. I'm the chairperson of the civil society in the province of Limpopo and also the co-chair Limpopo Provincial AIDS Council. Rena rele civil society. Rena la mokgwa e le re dira dilo e re fihlile bathong. Mara ke nyaka gore before re dira dilo tša rena tša civil society, Honorable DP, ke re mo Limpopo re na le welcome batho ka gore na re a lo tšhariri, rona re a lo tšhariri ma, awa re a lo tšhariri, rena re a lo tšhariri ma, rena lekile la re bona ka. Re le koroni, bušong sa utlile, isitselela. Ahe, re a ulotha, ombo re a ulotha, re rema, amma mabulowe, hodungwale, Moria Sekhukhune, Tovela Mureda, Likile la de Bonaka, Really Coroni, Muso Musa Utile, Isitele, Aulota, Nare alo. Manda, forward with socialism, forward. Rise, civil society forum, rise. Repilele, solinduku, repilele. Eagola, civil society, eagola. Ba amurele, popira matuba, ba amurele. Repilele, Dr. Ramatuba, repilele. Amanda. Re amogele comrade Masha, re amogele. Se agola Sekhukhune ka mmagonoa se agola. Amanda. Re fodiše MEC, re fodiše. Re kgopela Paul Mashatile, re fodiše. Amanda. Awetho. Re a leboga, re welcome-ile batho ka mokgwa wa Limpopo. Ne maoko enko o lead batho ka o betha matsogo mo. Re amogele baeng ba rena re ba bethele matsogo ba fihlile Limpopo. Ke yona Africa's Eden ye re bolelang ka yona. Re a leboga, re ke tšee sebaka se ke re gore ke ska senya nako ke re Honorable Deputy President, Honorable Minister, Honorable Premier, Honorable Executive Mayor of Sekhukhune, Comrade Solinduku, and protocol observed, Eriki Chesbaka Segili Dumelish. Reto Chesbaka Serili Civil Society observe a program, Revicha, the one of our own, the vibrant leader in the PLHIV sector, the chairperson of the PLHIV sector in this province, under the civil society forum of this province also. As the civil society, we welcome Comrade Kensani Mabasa to come and give message of support. Comrade Kensani.
Good night.
Amandla! Amandla! Viva community, viva! Viva Mwina, viva! Viva Mina, viva!
Thank you, program directors, for this opportunity. Niranza kuya sheweta kusuka ka Deputy President. Niya ishenge kuhambana ka swona kuya ehansi. Ni sheweta vurhangeri bya hina ka civil society. Ni sheweta hinkwavo varhangeri ti officials kusukela kwale ka National Department of Health na ti department letin'wana hinkwato. Ni karhi na mina n'winyi ni karhi ni ti sheweta. As we are commemorating this day, it has to be at the back of our mind that this is not just a day as ordinary days. It's not just another commemoration day or another World AIDS Day. We have to take note that this is the opportunity to meet the community. This is the opportunity to engage with the community, to listen to what the community is saying, to listen what the community are saying are their challenges, and also the strategies that is working for them, not what we think is their need and it works for them. We have to take note that as the PLHIV sector in the province, if I'm not saying the whole country, we are still facing the issue of stigma and discrimination. When we look at our rural communities and in the deep rural areas and also semi-rural areas, we are still facing a lot of challenges regarding stigma and discrimination. And it will only take the community to address that. We It comes to the issue of accessibility, the issue of affordability, the issue of availability. We know it has become a disaster in our country. But I want to appreciate our government that as they have promised the HIV treatment will never be interrupted, it is happening. I think we have to acknowledge that. As we are honoring those whom we have lost due to HIV and AIDS, I think it's high time we also honor those who go for testing, start to take the treatment, and adhere to treatment. It is not an easy thing. It takes an individual's commitment and also the effort for a person to adhere on treatment. As the theme of this year is talking about renewed efforts and sustainable commitment to end AIDS, we're not going to talk about that if we are not renewing everything that it talks to the community. If we are not talking about the resources that are being channeled to address those challenges in our community. I'm glad I was part of the build-up activities. I attended one that was arranged by the DSG and also the one that was arranged by the National Department of Health and SANAC. People were talking, people have spoken, people have pledged, people have indicated what is it that is going to help us in addressing the issue of HIV and AIDS. And I believe that the commitment that the leaders or those who were leading the program, that we are going to report back to us, we are going to hear that. It was not just other meetings like some other time previously. There are two things that I quoted from the dialogue that happened at Mahwabe Hall. The DSD has made a commitment to say we are strengthening collaboration between the civil society and government. I think that is one other thing that we have to take note as the people of Sekhukhune. And the National Department of DSD was there, and the provincial one and the district. And they even promised the challenges that came out from the dialogue, they will submit them to our Premier, because some of the issues we were calling for the Premier to take action, and also our MEC. And I'm saying this that when our Premier and the MEC, when you don't see the report in the 2 weeks to come, ask them. There was also a commitment on the issues that were coming out from the women right or the women's sector, where women were highlighting the challenges that they are facing when they go to access services in the facility. Even though we were focusing on the issue of cervical cancer, there were lots of challenges that were put on the table for our province to can address. And I'm glad that the national also took over on what they think is the things that they need to address. And they also promised they will submit our call on the action and some of the things to be addressed by our province. And the submit our Premier and the MEC in 2 weeks to come, Babujishe. Or what is it that the people of Limpopo said and what are the proposed solutions? Because it was not only raising challenges, but they were also proposed for recommendations on what needs to happen. Yesterday, there was the accountability meeting that was led by the PLHRV Sector National, and many people attended, civil society, different departments, and I'm glad that on some of the issues there were commitments from the National Department on what are the things that they are going to address, and there were also some of the commitments from our provincial department who can address. There's still a lot of challenges that are happening in our communities, even though there's a high level of progress. But remember that the challenges that we faced from January, it was like racing back to zero on some of the activities, and a lot of challenges come on emanating. I want our Deputy President to take note on the Rishiza report that was presented yesterday, and also our Minister of Health. There's still a lot of challenges when it comes to long waiting lists in our health facilities. There is still the high challenges when it comes to stigma and discrimination, and of which some of these things are the ones that are making people to leave the facilities and not go back. In these build-up activities, there were also door-to-doors where people were indicating why they are no longer going to our facilities. And until those things are addressed, we're not going to see the 2030 HIV generation free. There's also the issue of staff attitude that is also leading people not to go to facilities to seek services. And there's also on the issue of treatment, I understand that our government is doing very well, but we have to take note that treatment and prevention has to go hand in hand. We have dropped the ball as a country when it comes to the issue of prevention. We know in our facilities, those of us that we are using the community facility, we know the challenges that are there. Yes, in terms of treatment is 100%, but in terms of accessing other medication or for other illnesses is a problem. You go to a health facility, you are sick, you are told that we're not having this medication, and now it's 4 months. So it shows that there's a lot of challenges that are happening in there. In terms of the issue of PrEP, our country, we are still low. And in our province is another challenge again, and I hope that will be taken note on. On the issue of 6MMD, other provinces, yes, they're doing well, they have started, but our Limpopo province, we have not yet started. And I believe that by March 2026, we'll hear the progress report, because people are ready in Limpopo, those who are stable, to go to the clinic twice a year, and they are adhering to treatment. So this calls for an agency to our MEC to start rolling out the 6MMD before January 2026. By March, we want to hear the report. On the issue of the 1.1 million, yes, it has been a good strategy, the big one, that is aiming to address the challenges and also bringing back the laws to follow back to the facilities so that they can take their treatment and adhere. But we know the fact that it has come with challenges. Although we are not supposed to focus on the challenges, we have to work together to address them, but it was a challenge, And also the communication from our national department to our provincial department, it was not good. Where you want to get some answers from your MEC and you find and you ask yourself, who's going to answer me? So to our national department, yes, you come with good activities and programs and everything, but you have to understand that there is no national without province. You must take note that you must clean your house and ensure that there's proper communication. This also goes to our civil society from national to province, and also within our PLHIV sector. We need to clean our house in terms of communication, and we must hold each other accountable. As much as we can hold the government accountable, we must also hold each other accountable. That's where we can talk about 2030 HIV negative generation. And in terms of funding, we know, and I was disturbed a little bit. I remember when this 1.1 was introduced, we were told, well, there's no money, but we were told that we must do plans. And we did those plans, and we asked, how much are you having for the provinces? And we were told that there's no money. And then, after you have done your plans, we'll go and raise funds. But surprising, after doing the plans and we wanted the money, we were told there's no money. And if we can take note, the civil society is shrinking due to lack of funding. There are lots of things that are happening, but one thing that I want to highlight is that our department, Leskare Luisha Modu Province, and Lilina leadership area from national, from civil society, Lilina Leskare Luisha. And even if you get funding from our government, it does not mean they are not your friend, you are just working together. And working together does not mean that you have to agree on everything. We'll still have the disagreement. And our government, you have to understand, when we have disagreements with you, we are not fighting with you. We are showing you the way as we are assisting you in addressing the issue of HIV and AIDS. In terms of strengthening the communities, I've indicated that we really need funding to be channeled there to our communities. But if we are still having corrupt officials, we're not going to reach the goal that we want to reach. And Deputy President, this is a call to say if there are any officials that are corrupt, let them get fired. We call on to can use the CLM model. We have seen that it is working. The CLM model goes to the community. It talks to the community. It has the meaningful engagement with the community. So it's high time we don't plan for the community, but we plan with them. That's where they'll also give us this guidance to say, this works for us, this works for Limpopo, and whatever that works for the other province does not mean that it will work for the other province. As I'm closing, Program Director, the last one is to remind the civil society, we have to remind ourselves about our mandate. Our mandate is to advocate for the best interest of the people, to mediate between government and civil society, and ensure accountability, holding institutions accountable, and also advocate for policy change. Thank you.
Thank you very much, the chairperson of the PLHIV in the province. I'm just going to make an emphasis on this one. The speakers that are still going to follow, please let's stick to time so that we do not find ourselves exhausted before we could even hear the keynote address. However, we are happy that everybody that's going to come here is going to express themselves. I think most of the things that were said by the chairperson was more of emphasis from the build-up activities that has prevailed since we have started. I'm going to be calling upon the statement of support from the Salga, Councillor Begestofil, and then the cultural group, Marumo Amushate. Please prepare yourself. After the speaker, then you will give us an item. Thank you so much.
Thank you very much. Greetings to you, Program Director. Greetings to the Deputy President, the Minister, the Premier, the MEC, and our mother that goes with the Deputy President. Our message, Program Director, is going to be very brief. Brief in the sense that we are happy, President, as the local government sector, to participate in matters that affects the communities. It is indeed, as it has been stated by the mayor of the local, that over a period of this build-up towards this activity, the municipality in the district and at the local general, they have been engaged with these matters. And our understanding of these processes, Deputy President, is that municipal system in the Republic of South Africa is three-legged pot as per Municipal Structures Act, is the community, is the council, is the administration. And therefore the program that we are driving together with the Department of Health begins to speak directly to the real core mandate and responsibility of local government in partnering with different spheres of government in rendering service to communities. And we can only succeed in doing this, President, if we collaborate and intensify our collaborations in all different manners that we had to implement our programs. It is important for us as the local government sector to pass the message that on behalf of 257 local municipalities in the Republic of South Africa, we do support the program in fighting all the scourges that are dividing our communities, that include the HIV and AIDS, the hunger, and many other instruments that are disadvantaging our communities. As local government, we are readily available to partake and participate fully in matters that seeks to change the conditions and the life of our people in various areas throughout the 9 provinces in the Republic. It is important, Deputy President, to highlight that part of the difficulties that we face, all of us, in the journey in trying to address the difficulties that we are facing is the austerity measures that are put in place and the underfunding of the programs that government as a whole is trying to drive in the changing of the conditions of our communities in the areas where we live. And it is our call that it is important to dedicate some time in making sure that in matters and areas such as this one, such as HIV, AIDS, TB, and other related matters, we put some significant resources in addressing these challenges so that our communities are able to live longer. And that is why, as South African Local Government Association, we implore on our member municipalities to factor these programs in the IDP so that as the strategic document in responding to challenges that our communities are facing, so that they can be able to monitor our implementation through SDP. It is important for us to find this program in this project in so that we are responsive to challenges that communities are facing in our area. It is important, President, that together we can close our gap and use the strength that we have to pull all resources towards projects that seek to address the challenges that our communities are facing. That is why we are happy as South African Local Government Association that we have started a project called Clean Up Campaign, Clean the Cities, the Towns, and Municipal Areas, so that we attract investors to come, so that they can invest in our communities, so that our municipal system can change to be a different municipal system that addresses the challenges that communities are facing. It is our call that therefore we cannot succeed in this journey as a municipal system alone without the collaborations and the relationship between the local government and the provincial and national government, and also some financial resources that it can be drawn from other role players such as business communities. It becomes critically important in addressing these challenges that we are facing. This program, President, it reminds us a time that all of us in South Africa, when we struggle to gain freedom and democracy in South Africa, we collaborated and we pulled each other towards focusing to a project of freedom. And today we can use that strength, collaboration amongst spheres of government, business and communities, so that we can change and make an impact to our communities. Our message today is that it is and it can be achieved if we hold one another's hand and pull together towards addressing the challenges that our society is facing. I thank you.
Thank you, Salga. Maruma Mashate, are you ready? Where are they? Maruma Mashate? Are you ready? Where are they? Yeah, as and when Maruma Mashate, they are coming through to perform. Are we having them? So that we can move with the program. But just to make emphasis also from Salga, we need also your IDP to include the interest of us as the civil society, particularly in terms of the HIV and AIDS program. And one of the key things that also arises is the issue of nutrition, which we also emphasize as the civil society, that let's work together in making sure that, particularly the people that are living with HIV, so that we are pushing this thing of nutrition. They must get the parcels. So you have to have ways of how do you integrate these programs so that we can push around. Marumo Amushate? Okay. When they are ready, they will tell me. Let me move with the program. I can see that they are not ready. Can we go for message of support? By Hoshi Lebelo, Bagadi Fukeng, Rhopela le first message of support, Gertli Lemo, Reatseba Bilaria Dumela Gore, Area Ganera, Arba Amreling Kalezo.
Let me greet your first program directors. His Excellency, the Deputy President of the Republic of South Africa, Mr. Paul Mashatile, the Honorable Minister of Health, Dr. Aaron Motsoaledi, the Honorable Premier of the Limpopo Province, Dr. Poppy Ramatova, the Executive Mayor of the district municipality and the mayors present here, the chairperson of the South African National AIDS Council, honorable members of the Executive Council present, our esteemed host, Ga-Masemola, and the entire community of Ga-Masemola, my colleagues, senior traditional and Khoisan leaders present, distinguished guests, community members, ladies and gentlemen, a very good day to you all. Commitment to health. It is an honor to stand before you today in the vibrant heart of Ga-Masemola village to commemorate World AIDS Day, a day of remembrance, solidarity, and unwavering commitment. I convey the sincere apologies of the chairperson of the Limpopo House of Traditional and Khoisan Leaders, Wosingo Peningove, who unfortunately could not be here today due to family bereavement. And I'm privileged to deliver this message of support on his behalf. We stand here shoulder to shoulder under the powerful banner of our theme, overcoming disruption, transforming the AIDS response. Our presence today, especially in the presence of the highest office in the land, is a testament to the fact that the fight against HIV/AIDS remains a national priority and a deeply rooted concern for every traditional council, every village, and every household in Limpopo. Overcoming disruptions Your Excellency, the honorable leaders, the term disruption is one we understand intimately. Our communities have faced many crises, from the brutal disruption of colonialism to the recent global pandemic that was COVID-19. The recent health crisis acted as severe roadblocks, diverting resources, attention, and energy away from the critical work of HIV prevention and treatment. Clinics faced challenges. Community health workers were stretched thin, and tragically, adherence to the essential antiretroviral therapy was sometimes compromised. Yet, in the midst of this disruption, we saw the true resilience of the South African people. We saw the vital role played by our traditional health practitioners and our community structures, the very core of traditional leadership, stepping up to ensure continuity of care, fighting misinformation, and providing vital psychosocial support when formal channels were strained. It is precisely the spirit of community-led action that allows us to state with confidence we have overcome the recent disruptions and we are ready to advance. Transforming the AIDS response, the role of traditional leadership. The second part of our theme, transforming the AIDS response, places a clear mandate upon all of us, particularly on the institution of traditional leadership. Transformation means moving beyond crisis management to building a truly sustainable and stigma-free response rooted in cultural understanding and respect. Number one, champions of prevention and treatment. As traditional leaders, we are custodians of culture, but we must also be the champions of public health. Bullet point number one, eliminating stigma. We must use our authority to dismantle the debilitating stigma and discrimination that still forces people living with HIV into silence and prevents them from seeking help. No member of our community, especially our children and youth, should ever be ostracized due to their health status. Bullet point number two, embracing modern prevention. We commit to driving the uptake of modern prevention tools, including condoms and pre-exposure prophylaxis, and ensuring that voluntary medical male circumcision is conducted under the strictest clinical supervision as part of a comprehensive strategy. Bullet point number three, initiation schools. We recognize the unique responsibility we bear concerning cultural practices, particularly initiation schools known as Koma. We commit to ensuring that these sacred institutions are safe spaces for dialogue on health, where screening, testing, and culturally sensitive education on HIV, STIs, and gender-based violence are non-negotiable parts of the curriculum. Number two, upholding the rights of the vulnerable. Transformation demands that we focus our attention on the most vulnerable groups, our young women, adolescent girls, and key populations. The intersection of poverty, gender inequality, and cultural norms often leaves our young women disproportionately affected. We must actively support programs that empower women, challenge patriarchal norms that fuel the epidemic, and provide safe spaces free from the scourge of gender-based violence. In conclusion, program directors, a legacy of health and dignity. To His Excellency, the Deputy President, to the ministers, the Premier, and the SANAC Chairperson, the traditional and Khoisan leaders of Limpopo Province are not merely partners in this fight. We are frontline commanders. We stand ready to utilize our vast networks and deep influence to ensure that, number one, every person in every village knows their status. Every person living with HIV is on treatment. Every person adheres faithfully to their treatment regimen. Every community is a place where people living with AIDS, with HIV can live openly and with dignity. Let us commit today to transform our response from simply managing the epidemic to ending it, ensuring that we leave a legacy of health, dignity, and cultural vibrancy for the generations that follow. We are united, we are resilient, and we will win this fight. Nkosi sikelele Africa. God bless Africa. Thank you.
Halala Limpopo, halala. Halala Limpopo, halala. Community way. Ki khopela re ishe leshata fase. Milaetsa e ba e bolalang mo e bohlokwa ene se biletswa mo go re tle re kgone go kwa milaetsa yeso ke a khopela tswetswe le ba ba fanang ka metsi re tie metsi a rena quietly so gore milaetsa e kgone gore e fihle ga botse mo ditsebeng tsa batho re tla tswela pele ka cultural group ya rena ba re ba ready maruma moshate ba tle ba re fe item eo sebaka ke sa lena re khupele ba Sanek Private Sector Forum statement batlofa statement of support from business Dr. Tutula Balfour abe ready immediately re ba fetša ka item ya rena sebaka ke sa bona ene ke tla khupela dibuledi tše re di bitšang mo le na le 5 minutes to present your message re emella gore o tla be o feditše 4 minutes re go fa a minute to conclude molaetsa about the message that you'll be presenting to batho ba leng gona fa maruma moshate sebaka ke sa lena
Thank you very much to our program directors. I will try and be short and therefore will acknowledge our Deputy President, our Premier, and our Minister, and all protocol observed. We know that there are very important dignitaries with us today. Therefore, I'll go on and say, Dumelang, Tobela, Abusheni, Sanbonani. I must say I'm very happy that this event has been organized here. I would never have come here, and therefore I'm very grateful to the Deputy President and SANAC for bringing us to a place where it's a rural area, we were told, but the houses are like in Sandton. And of course, everything is Ga-Moloi, Ga-Marishana, Ga-Masemola, Ga-Phahla. I thought I would see Ga-Motsaledi, but I'm sure it's there. It's an honor for me to join the SANAC partners as the SANAC Private Sector Forum in commemorating our World AIDS Day with the theme Renewed Efforts and Sustainable Commitments to End AIDS. As stated in the 2025 UN AIDS report, World AIDS Day 2025 offers an ideal moment for global reflection on the massive progress made towards ending AIDS in the new world order relating to HIV, and on the urgent need for solidarity and global commitment to end AIDS as a public health threat. Global declines in international health funding, together with abrupt reductions in international HIV assistance in 2025, are threatening to unravel decades of progress in the fight against HIV. Ending AIDS requires that we reach out and engage everyone who is living with, at risk of, or affected by HIV. We need to collectively develop and implement measures to ensure the long-term sustainability of our HIV response. In line with this, and to strengthen our SANAC Private Sector Forum representation, we have completed the establishment of all 9 provincial PSF private sectors in the provinces. And this will allow for regional structures to have better insight into provincial implementation plans and provincial sustainability plans. And in Limpopo, we are in the PSF ably chaired by Nelly Sibabi, and Bulelwa Mpofu is head deputy. We wish them all the best in steering the private sector in the province. We would like to thank our SANAC partners, government led by the Deputy President's Office, the leaders of civil society, and the SANAC Secretariat for supporting the establishment of these forums. For 2025, our co-funded community outreach initiatives as the private sector were co-funded by Seriti Resources, Exaro, and Afrocentric, Africa Sky Blue Community, and Life Assist. Their campaigns were held in the Garsibande districts of Mpumalanga and also Nkangala, and they screened approximately 25,000 people. Exaro has committed a further 3 million towards health screening for community members in Mpumalanga, and that started in November. These are some of our contributions to a current situation that calls for better collaboration and integration efforts by all parties. We support the drive towards renewed efforts and a sustainable HIV response that, number one, brings essential HIV programs to people who need it, including the imminent successful rollout of lenacapavir in South Africa. We need country-led efforts to ensure long-term sustainability of the HIV response. We also need to cultivate and optimize partnerships. These are partnership models at national and regional level. Finally, we also need to drive innovation to maximize impact and optimize efficiency by adopting data-driven approach. Ending HIV by 2030 remains an achievable goal. It is going to require collaborative efforts to ensure that those living with HIV start and they remain on antiretroviral therapy. In parallel, we must retain access to HIV prevention tools and support a successful rollout. South Africa is known as the land of possibilities, and we can achieve anything we want if we pull together. Now is the time for us to do so. Let us all put our shoulder to the wheel to end AIDS, TB, and other diseases. I thank you.
Thank you so much. The speakers that are still going to come will keep on making the emphasis to this one. Please and very please, let's stick to time. We just encourage people to stick to time. Because when I look at the program, I see that there are still people who are going to speak. And there's somebody that I know is still going to take time. So I don't want that person to come back and say, you didn't tell others. So please and very please, let's stick to time. It's fine, we're moving along. Thanks very much, the private business sector. We are going to be calling the message of support, if you know the statement of support, by one of our own, the national chairperson of the Civil Society Forum at SANAC, the cadre of the movement, our activist, the leader, progressive leader that we have. Like I said, it's one of our own, comrade Solin Duku, Magabana nazi ukuthi senzani. Comrade Solin Duku, please and very please, this is your time. We are here because of you. Let's welcome Mr. Babanduku to the stage. Please and very please stick to the time as well.
Your Excellency, the Deputy President and Chairperson of the Council, Honorable Mashatile, our Second Lady, Mema Mashatile, Bamushati, Baga Difugeng, Minister of Health, Honorable Motsoaledi, the Premier of Limpopo, Honorable Ramathuba, Deputy Ministers in attendance, members of the Executive Council, the Chairperson of SALGA, and all the councillors in attendance, leaders of the civil society as led by the First Deputy, Comrade Sheila, PLHIV sector, as led by Comrade Mluleki Zazini, colleagues, comrades, the supporters led by Dr. Kulu from SANAC, esteemed ladies and gentlemen, good day. We have gathered not merely as attendees, but as active participants in a historic journey, a journey defined by resilience, commitment, and shared responsibility. We stand together to take stock where we are, to evaluate the progress we've made, and to reposition ourselves for the road ahead of us. The path we are traveling requires determination, unshaken courage, and constant renewal of energy and resolve. This fight calls not for passive presence, but for active engagement. We are here, colleagues and comrades, to reflect on our victories, both big and small, and confront our challenges with honesty and strategy. We gather to chart a new direction as we march towards the elimination of HIV, TB, and TB as public health threat by 2030. This is not a dream, it is an achievable goal guided by our national strategic plan. And as Civil Society Forum, we declare today that we are ready to conquer. We are ready to ensure that we reach that destination, and together we can do it. Comrades, it will be a grave injustice if we do not recognize and applaud the decisive leadership provided by the SANAC plenary, led by the Honorable Deputy President. As last year we stood at this podium, we called for the implementation of 6MMD, and today we stand with gratitude and appreciation because the call was answered. He has delivered. That leadership has given us a momentum during times where resources are strained and financial challenges threaten to weaken our progress. But instead of discouraging us, these challenges must push us to work harder so that none of our gains get lost. We must defend our progress with all what we have. Comrades, we are close and we are very close. Now more than ever before, we must endeavor, we must encourage each other, we must support our brothers, sisters, we must encourage and support our parents and children who are on treatment and encourage them to remain on earth. We must make sure that all they remain consistent on treatment in order to ensure that 95% of people living with HIV remain undetectable, and undetectable means untransmittable. That is how we'll eliminate new infections, and this is how we are going to win the battle. We must continue amplifying HIV testing. When people test negative, preventive tools are available to protect them. When they test positive, we must ensure immediate initiation to treatment so that no one slips through the cracks. Let us lead with love, with information and action. We further urge women, especially women living with HIV, to undergo cervical cancer screening because prevention and early detection save lives. Tuberculosis remains a parallel challenge, and as civil society, we say loudly, TB is still our fight. We call upon each and every comrade, every leader, every community member, every household to prioritize TB screening so that we can collectively reach our 5 million screening target by 2026. If we stand together, we can meet and surpass that goal. Comrades, Close the Gap remains a critical intervention that helps rebuild momentum towards 95. The evidence is visible in communities and facilities, and therefore, we call upon our Honorable Minister to safeguard and further strengthen this program. The results speak for themselves. Our journey requires united front, and no fragmentation. It requires no division. SANAC remains our coordinating force, and with it, we are well positioned to achieve elimination by 2030. Today, we also raise to address another epidemic of gender-based violence and femicide. We call on all men to take responsibility, to be protectors of life and not to be perpetrators of harm. We urge men to visit health facilities for HIV testing and TB screening. For a nation cannot progress while men fear healthcare or silence their pain. We also call on government to seriously consider the plea from sex workers sector to ensure that sex work is work and it gets legislated. Legal recognition is safety. Legal recognition is dignity. Legal recognition strengthens the HIV response. We cannot speak about inclusion, whilst exclusion, we are excluding those most vulnerable. Comrades, we celebrate scientific progress, particularly the breakthrough of the Lenacap affair, a game changer in HIV prevention. As we move towards 2030, long-acting prevention options will protect millions. We encourage young girls and adolescents, young women, and all key populations to consider this prevention method. Just 2 injections a year that bring freedom, that bring consistency and hope. We are eagerly awaiting for the rollout, Honorable Minister. Honorable Deputy President, Honorable Minister, SANAC CEO, Premier of Limpopo, MEC, SANAC co-chairs and sector leaders, Funzelani Pambili, sisemva kwenu. We stand by you. We walk beside you, and we carry this vision together as we call for the NHI during our lifetime towards the attainment of the universal health coverage. Amandla, aluta, continua. Ngiyabonga.
Siyabonga Matsoro. Re lebogile molaetsa o mo botsebotse re tswela pele ka program ya rena di-item tša rena tše re na leng tšona re tlo di rendera after re receiveile melaetša ka moka, meaning we'll skip so we'll skip all the musical items and all the activities to give opportunity to our speakers to come, and then we'll have those activities after the meeting. So we'll then call on stage Ms. Eva Kuango to come and give the message from the United Nations family.
Thank you, program directors, Your Excellency, the Deputy President of South Africa, the Honorable Minister of Health, other ministers and deputy ministers present, our gracious host, the Premier of Limpopo, Chairperson of SANAC Civil Society, Executive Mayor of Sekhukhune, distinguished guests, allow me to stand on existing protocol. Esteemed guests, Tobela. I would like to start by conveying the appreciation of the United Nations Resident Coordinator, and the representative of the Secretary General in South Africa for the invitation to the United Nations to attend this commemoration. We are gathered here today to pay tribute and honor the people who have lost their lives to AIDS. We lived with them in our communities. They are our fathers, mothers, brothers, sisters, cousins, our friends and children. Before we turn to this year's World AIDS Day theme, let me congratulate the government and the people of South Africa on the historic success of its G20 presidency. The first time the G20 summit has been hosted on African soil. We also thank South Africa and the United Kingdom for hosting the historic Global Fund 8th Replenishment Conference last month. Also the first time ever held on the African continent. This year's global and national World AIDS theme captures the urgency of this moment. The abrupt disruptions in international HIV funding affected HIV prevention, community-led services that reduce risk and empower women and girls and support key populations. But we have the power to transform. South Africa stands at the center of both these realities. Yes, it has the highest burden of HIV in the world, yet South Africa is also leading with courage and innovation. During this tumultuous year, South Africa has refused to let disruptions halt progress. The Close the 1.1 million ART gap campaign is finding people living with HIV and getting them on treatment. The Better Man for Tomorrow movement is supporting that effort, tackling stigma and engaging men living with HIV. The country is rolling out 6-month, multi-month dispensing of ART and is already planning the rollout of lenacapavir, including the successful registration by SAPRA of this game-changing prevention drug. And yesterday, once again, we witnessed the resilience of community-led monitoring. Despite the funding cuts, PLHIV sector, through the Treatment Action Campaign, continued to collect data from more than 33,000 people in 19 districts. Today, South Africa funds nearly 80% of its HIV response, a commitment unmatched in sub-Saharan Africa. Every rand invested in prevention and treatment yields returns through reduced health costs, increased productivity, and a healthier, more empowered young population. Ending AIDS is not only a moral imperative, it is an economic necessity. We commend the strong leadership and continued commitment of the government. The presence of the Honorable Deputy President and so many leaders here today is a powerful signal of continued resolve. On this World AIDS Day, the United Nations pays tribute to the resilience of South African communities. The inspirational advances made in the HIV response have been powered by global solidarity. The health and debt commitments in the leaders' declaration at the G20 summits reinforces signs of hope. We applaud the strong demonstration of global solidarity at the 8th replenishment of the Global Fund, where partners worldwide pledged 11.34 billion. We need those pledges to continue to grow, and we're looking at the private sector. the commitment to multilateralism and leadership in South-to-South collaboration, sharing technology, innovation, and grant funding by countries like China are powerful examples of working together to overcome shared challenges. So in closing, the United Nations in South Africa stands with South Africa as you advance toward ending AIDS as a public health threat by 2030. We are united behind the heroes of the response, together by matching science with solidarity and resources, with resolve. This generation can be the one that finally ends AIDS. Riale Boha.
Re a leboga le rena re tswela pele ka lenaneo la rena re tlo hwetša Limpopo Provincial Response to HIV, TB and STI yona re tlo e direla ke moetapele wa rena mo Limpopo mmago Limpopo o eteletseng pele province ya rena ya Limpopo re mmitša ka Mrs. Service Delivery ki Dr. Poppy Ramathuba, ki kgopela le mmetele matsogo a satla mo stage our ever active Premier Dr. Poppy Ramathuba.
Thank you, ke a leboga molekgotla phetiši wa kgoro ya rena ya tša maphelo. Ntumelle ke thome ka go tamiša ba ka Difokeng ba ka Mošate ke re ke tamiša Kgošigadi Ga-Masemola ba re bontšitšeng gore ntše re na le bona maabane kua thapelong e kgolo kua Makhueng bjanong ba šetše ba sa lokiša tše dingwe le magoši a mangwe ba aparang kwe gona kua ba na le di-meetings tša bona mara empa ba rometše maleloko a Royal House Council re na le Moditi Mabue le Nkgao Masemola ke re a le tamiša re le mmušo wa rena wa mo Limpopo ke re modulasetulo wa South African National AIDS Council e le bona Deputy President wa rena Deputy President wa South Africa hape e le Deputy President wa mokgatlo o bušang ba re nyako ba leboga ka gore sa mathomo ba bone go le botlhokwa gore Limpopo e be province e ngwaga o ha re tla commemorate letšatši le e be rena re ba hostang a re ba amogele le go leboga decision ewe ba e tšereng sephetho seo re re Deputy President re a tseba gore mamutla go na le National Executive Committee meeting ke nyaka gore ke le bontšhe lena ba le reng re mmušo wa o sekhere Deputy President is also our Deputy President in the ANC ne ba tshwentše ba le meeting wa committee e kgolokgolo wa o tšea diphetho tše di amang le gore nna le mpitše tonagolo mara ba choositše lena batho ba Limpopo ba choositše commemoration ya World AIDS Day as compared to NEC meeting ba no ifile sa bone gore mmušo wa lena wa lerata ke sa tseba gore ba tla dira tše dife a ba tsamaye ba le noši ba tsamaya le ngwana mobu ke ministera wa rena gape le yena ke moleloko wa National Executive Committee le yena o rile hawa ke tla di bona tšeo mara e re thome fa le Deputy Minister tše di leng fa le di ministera go ya ka kgati ya lena Executive Mayor wa rena e le Mmagonoga re a le leboga re leboge le Mayora wa rena le di Mayora ka moka me go setšhaba sa Afrika Borwa e le yena the second lady mmago rena kgale re na le yena a ke tsebe gore ba se o fa sereto na ka gore mo Sekhukhune ba fa sereto ba tla re botša I'm sure ba šetše ba mo file ke a makala MEC ha o sa re botša sereto sa gae e le yena mme motswadi wa rena mme Gumile Mashatile o bile le rena go tloga le Friday nana le bana ba rena make sure mmereko o tswela pele re a leboga lena ka moka ga lena boetapele ba civil society boetetše pele ke comrade Soli le di-sector ka moka people living with AIDS men sector all of you e re ke le tamišeng ke le botše gore protocol has been observed ka moka lena ke a le recognize because if nkaya ke le dumediša ka moka one by one nako ya ka ya go fa response e tla ba ya fela le ntshwareleng batho ba Sekhukhune batho ba Ga-Masemola batho ba mo Makhuduthamag gore re tla re ga re bolela ra ntse re tsentšha le sejatlhapi ke a tseba gore le ya complaina gore mara Ga-Masemola go bolelwa Sepedi why o bolela Sekgowa le bone re tlisitše le batho ba United Nations ba UNAIDS ba fa batho bao ke bona ba re fang mašheleng banong ga nka bolela gore re nyaka mašheleng ko bona ba ka se nkwe ba tla tsamaya le mašheleng a bona a kere ba tla no kwa lena le phaphatha matsogo ba ra wa diloko Limpopo di lokile kanong tumeleleng ke bolele sejatlhapi gore mašheleng a ba a tshwereng ba a šie mo Limpopo ba kwe gore ke reng lena le batho ba ka ke dula le lena le a tseba gore Sepedi ke se bolela twi a ke nyake toloki mara mmamotla ba ba o se nyake toloki e re ke bolele le bona ke na le malekgotla phetiši ba ka ba tletše fa ga o sa nkwa o no goga o mowane wa re na reng tona gore o tla lotlhalosetše gore ne ke reng mara ba ke nyakang ba kwe ditaba a sheba. Let me appreciate both program directors for this opportunity as I extend my warm welcome to all our distinguished guests gathered here in our Sekhukhune district for this solemn and significant World AIDS Day commemoration. Today we are honored by your presence, the chairperson of our South African National AIDS Council, our Honorable Deputy President, His Excellency, Mr. Paul Mashatile. Your leadership, Mr. Deputy President, and your consistency, including your unwavering commitment to the HIV response, continue to inspire us as a province and propel us towards a deeper and accountability and action. To our civil society formations, you are the backbone of our community health and our community voices. We acknowledge your tireless work, often under challenging circumstances, especially with the minimum resources that you are always allocated to. But your presence here reminds us that the true fight against HIV, TB, and STI is carried not only in our clinics, not only in our laboratories, but also in our homes, where it all started, in our villages and in our schools, whether it's our prisons, our churches, and this particular district in our minds, because we are a district that is rich in mineral. So Program Director, this year, we commemorate the World AIDS Day under the theme, Renewed Efforts and Sustainable Commitment to End AIDS. These themes for us, it's both a call to action and a reflection of the ongoing challenges in our healthcare systems that continue to undermine the national goal of reaching the 1.1 million more people back to the treatment. So today is not merely a commemoration for us, but it is a renewal of a collective promise to all our people. As former President Nelson Mandela once said, it is in your hands to create a better world for all who live in it. On this World AIDS Day, we want to reaffirm that the power to end AIDS by 2030 rests in our united hands. As a provincial government, we must indicate, Deputy President, that we are committed to closing the HIV treatment gap of the 180,975 by December 2025. While we have not yet fully reached the target, which of course is a concern for us as the Provincial Executive Council, we must acknowledge the meaningful improvement recorded between October 2024 and October 2025. Just to share amongst others, under the global 95-95-95 target, with the resources that you allocated to us, Deputy President and Minister, together with all our donors. On the first 95, re kgonne ho fitlhella 93%. The first 95, just to remind all of you, gore ke ele 95 e re reng batho ba potential ba phelang ka kokwanahloko e ya HIV, 95% ya bona tshwanetse ba tsebe gore ba mo seemong sefe. A gore o ka ba o dutse o sa tsebe seemo sa gago. So mo Limpopo re kgonne ho fitlhella 93%. Gore re go sana le 2% e nngwe o dutse o phela le kokwanahloko mara o tsebe. Re tseba gore e ka se e tlo o bolaya ha o sa tsebe gore o na le yona. Mara ha o na le yona o tla kgona go e manage. So that 2% is the one that we must achieve, and we can't achieve without the collaboration of you, civil society, of the business sector, and us as government. The second 95 is the one that is a concern because we are only at 80%. That is the much work that needs to be done, because we are saying of the 95%, those people who knows themselves that they are HIV positive, 95% of those at least must be on ARVs. That is where we have a challenge, or we still have got missing people who are living with the virus, who knows that they are living with the virus, but they are not coming to get their treatment. So hence, we are saying on the third 95, we did perform strongly, Deputy President. We are now at 97%, indicating that our people, once they are on treatment, then our systems are able to support them well. Because when it comes to treatment outcomes, we are encouraged by the continued improvement in the treatment outcomes for both adults and children. Because this 97, where we have surpassed the 95, it simply means but baling more the ARVs. 80% LA 90%, 97% of the 80% in the ARVs of the 93% that we have tested are viral load suppressed, which is what Comrade Soli here was talking about. Who refuted 97% is for the first time a minister when we managed to get this one. We are also saying our adults retention in care, which we were at 83.9% December 2024. Today we are at 87.6%. The viral load suppression, we also moved from 76.6% to 83.9%. But when it comes to our children, which is where our passion is, because President General Oliver Tambo said, a nation that doesn't take care of its children does not deserve a future. Rena, Deputy President, at least on this one, we deserve a future as the people of Limpopo. We have been able to reach 95% child retention care, up from last year when we were at 88.9%. A remarkable whooping improvement of 6.1%. Our child viral load suppression improved dramatically. This you must listen. From 52.8% to now 91%, a 38.2% improvement. What Labon, sponsors are clapping hands. Money is coming. See, give us more. You will see even the 1.1 million where we are not doing well, we will definitely get where we want to be. So when broken district by district, our Sekhukhune district where we are, they are leading by 98% of child retention. Waterberg district, we are also at 95.6%. Kwabembe, 95.4%. Mupani, 92.7%. Of course, Capricorn, 93.8%. So the viral load suppression for our children, listen carefully here. In Waterberg, 100% of our children, their viral load has been suppressed. There was a lot of work that was done between the civil society, government, and all stakeholders to make sure that our children have got 100% viral load suppression. Bembe, we're still at 93.3%. A lot of work still needs to be done there. Sekhukhune here, we are at 91.7%. Mupani, we are not doing well at 83%. And Capricorn at 86.2%. So this achievement simply shows us that where there's a will, there's a way. If all of us can come together and decide to work and stop calling names, our health professionals who are here, when somebody wants to test for HIV, don't ask him, or unaliti boyfriend or unali basadi ba banji. They are coming to you for HIV testing, test them without judging them. Because nobody is judging you, no one must judge another one. So some of the patients who complain to me personally, they would say we go to the clinic and we are asked names. So MEC, we are working together on this to make sure that our attitudes must not chase those who are seeking support. So our fight against HIV cannot be won by the health sector alone. It demands a unified government. And as led by you, our Deputy President, we know we are going to win. We know we will end AIDS in our lifetime. Hence, our local and district municipalities, we are satisfied that all our districts have launched their AIDS council. And all our district AIDS council are led by our executive mayors. That one we are happy about. We are saying the same must happen in our local municipality. We are saying the same must happen in our wards. As a ward councillor, you must have an AIDS council that you are chairing. Diseases are not in Polokwane or Civitas building. Diseases are within our communities, and if we want to prevent them, it starts with a ward council. So re khopela di ward councillor tja rena a re thome ho ba active re tsebe gore le rena bothata bo ke ba rena. If you don't want to agree with me, you must remember, for you to be called a ward, you have got a certain population. For you to be called mayor, it's because Makrutama has been able to meet certain numbers. For having Sekhukhune as a district municipality, we have got certain population. For me to be Tunakhulu of a province, it means Limpopo has got certain population. Now, if population perish, I must forget about being a premier. So it's you as a ward council. Therefore, it's your problem. It's not only my problem. It starts with you at the ward. So let's work together to defeat this particular pandemic. So from October to November 2025, we have seen multi-sectoral build-up activities here within our province, reaching out to more than 25,000 people across our district. And we're focusing, Minister of Health, not only on testing HIV, but the entire comprehensive checker in Pilo, so that we should be able to not only close the gap, but also deal with the NCD. Our non-communicable diseases have become our nightmare. When we look, even children who are still at school are now being checked and found to be diabetic, that's non-insulin dependent. We used to, when we were studying, we were told that the insulin dependent is for children and the non-insulin is for adults. But we are having the non-insulin in our children, which is also a lifestyle disease. So we are working very hard as the Limpopo AIDS Council, not only focusing on HIV, TB, but also going to malaria, going to cancer, to diabetes, to hypertension. Because we've seen the good work we've done on HIV. Mahosher now will tell you that they are no longer burying every Saturday people who are perishing as a result of HIV. But they will tell you they are burying 3 or 4 one Saturday, dying of cancer, dying of complication of diabetes and hypertension. So I must commend all our districts who have gone all out. I won't mention the numbers that you have been able to reach in terms of achieving the 1.1 million. Suffice to say, all the district Waterberg, it's now leading at 60%, but we are being failed by Mupani, which is at 39%. while Sekhukhune is at 58%, and Capricorn at 41%, and Bembe at 44%. There's a lot of work that needs to be done so that we can achieve the entire 100% of those people who are living with HIV but are not on treatment. We are saying, Minister of Health, from the 180,000, we've been able to reach 84,000, which is 47% in October 2025, an improvement from the 60,000 in July 2025. But we are not happy because these are not, numbers are not just numbers, they are more than statistics. They represent families that get restored. When you find one missing person, you put them on ARVs, you are saving a family. That's what we want to see happening because we want to end HIV and AIDS in our lifetime. I must also, on behalf of our provincial government, commend partners such as Ga-Masemola Health, our mining sector, and also particularly Glencore here, whose campaign also at Sifateng mine, we were able to reach more than 1,200 mine workers just in 3 days, where we've been able to work as a collaborative effort, and we've been able to save the lives because those that tested positive, we immediately initiated them on ARVs. Those that we found being diabetic were referred to the clinic. Some were not even aware that they are working with a dangerous disease like your diabetes and your hypertension. We've been able to refer them to the relevant. Our civil society partners continue to play an indispensable role, even amidst the pain of funding cuts. We stand with you, we hear your concerns, and we commit to advocating for greater support to sustain the community-led response. Colleagues, our fight for HIV cannot be separated from the fight against TB, against gender-based violence. As a province, we are committing, Deputy President, our Speaker is here, our members of legislature, they are here in numbers. We couldn't just have enough time to acknowledge them. But we are saying the legislature will be very soon looking at our TB caucus to be launched for this particular term, because previously we've been able to launch that. But also our fight for gender-based violence, where just in 2025 financial year, 3,676 new sexual offense cases were attended in our health facility. 2,869 survivors received the post-exposure prophylaxis. We are worried because behind these numbers, it's mothers, it's children, it's also men who suffer deeply. You might not think men don't suffer, but my experience, Deputy President, when 2 of our nurses were abducted in a clinic to be sexually violated by criminals, I was subjected to a situation where I had to meet the husband of one of the nurses and had to counsel him to say, it shall be well. Your wife, you gave me your wife to come and save the lives of our people. While she was in duty to save lives, she was abducted and she was raped. And I must advise and I must counsel that man and say, it shall be well. Minister, what was painful, which I still need counseling, was that when I met the husband, it happens to be my former high school teacher, who taught me well. I'm a doctor today because he was my teacher, and I failed to protect his wife. Therefore, that's why I'm saying to all those who are engaged in sexual and all criminal activity, you must know there are husbands behind, there are fathers behind those daughters, there are fellow men whom you are destroying. That's why we have to fight the scourge of gender-based violence and femicide. We want to reaffirm our partnership with the Department of Health, with South African Police Services, and our judiciary. Because here in Sekhukhune, it's fashionable now to start raping 90-year-old, 101-year-old. I don't know what is wrong with our people. Maybe one day they will explain to us, because majority of the perpetrators are men, whether you like it or not. Yes, women there and there, but majority are men. Hence, we support our men's sector in fighting the scourge of gender-based violence. So as I conclude, Program Director, as Limpopo, we refuse to lose the gains we have made. We have made a call to our district and local AIDS council to strengthen the oversight of the multi-sectoral response to intensify case finding, especially when we come to our 1.1 million. Minister and Deputy President, the team, they know, in our last AIDS council, I was not nice to them when we were fighting basically because of this 1.1 million. They are still angry with me, but they will understand one day why I'm saying we have to find everyone who is HIV positive out there and put them on treatment. They gave me a number of reasons that the numbers we were given, 180,000, it's not, it's duplication. There are so many stories, but my request to them is that I need evidence-based. It's only if there is evidence that I will start to take you serious. But my message is, let's work all of us together. Let's stop calling names, people who are on ARVs. Because you who is calling the other one names, you don't know your status. It's better to know your status. When out of some people were telling me that your testiwa because medical school will diagnose them. Abas no testiwa. No, it's the other way around. When you don't know your status and you fell ill, you start losing weight, people will diagnose you. So if you are afraid to be discriminated, test, take ARVs, nobody will even know. You might find that I'm on ARVs, beautiful as I am, none of you might believe. Because people are living with ARVs. It's no longer something that you must be afraid. In the past, when you refused to test, we knew because testing was death sentence. We will test you and tell you to go and look for garlic and beetroot. Now we have got a Minister of Health who has even brought you one tablet. Every day, our government, every day, our Deputy President, it's leading campaigns of looking for treatment that we can be, which is affordable. Before, before Harry Toma, because at that time I was a doctor when I initiated, but and it was simple. Now maybe don't worry, the one that is coming, the one for preventative, so that we do not, it's to make sure that we remove the stigmatization, because that is what is causing our people and not. So let's re-intensify. Let's also focus on TB screening so that Limpopo reach its 95-95, not as statistical exercise, but as a moral obligation. Deputy President, our distinguished guests, ladies and gentlemen, let us live here being inspired, being united, and being determined to end AIDS in our lifetime. But only if we walk this journey together. Ke a leboga, na cancer, inkomo, ndaribuga.
Halala, Premier Dr. Ramatuba, halala. Ramurata, mu Premier warina Ramurata. Halala, Limpopo, halala. Mo magaring a rena le Masibutsana wa rena ki ya mmona mo Miss South Africa Disability wa rena wa 2025 mo magaring a rena re mo amogela Masibutsana wa rena e bile re a leboga gore le na le rena fa re tswela pele ka lenaneo la rena re tlo gopela re be le di remarks le invitation to the Deputy President to speak. Re tsona re tlo di direla ki Minister wa rena wa tsa maphelo Dr. Aaron Motsoaledi a re mmetheleng matsogo a tla mo stage go tla re fa di remarks.
Ke a leboga baswara marapo MEC ya mo Limpopo le chairperson ya civil society. A ke tšee sebaka se ke tamiše ba ka difokeng ba Mošate o rileng gona beng mabu ba Ga-Masemola. Ke tloge ke dumediše le motlatša mopresidente wa naga Re Paul Mashatile le mohumadi ya gagwe wa neng le rena mo mme Humile Mashatile. Ke dumediše le premier ya rena ya Limpopo mme Dr. Popila Mathuba. Gape go ne le bašomišane ka nna kua parlamenteng ke Deputy Minister ya Social Development Ntate Hendricks le Deputy Minister ya Sports, Arts and Culture dipapadi le bogabo mme Peace Mabe a ba no le dumediša mo ba dutšeng gona. Ya mme Peace Mabe ba ba mo tsebang ba mmitša Mokhanyakude e le gore ba Sezulu la mmona gore ber so ba re ke Mokhanyakude o kganya a sa tla kua wa mmona gore mme Peace Mabe o fihlile jale ke Deputy Minister wa rena wa dipapadi. Ba gešo ke ngwaga wa bo 44 ba ba di tsebang re swere ngwaga wa bo 44 re phela ka twatši ya HIV and AIDS. It's nearly half a century. Ka morago ga 6 years e tla be le half a century re phela ka twatši ye ya HIV and AIDS. Bjanong ge le lebelela theme ya tšatši le la legolo ka gore ke dula makgweng a ke sa tseba Sepedi gabotse ke ile ke botša mme a ra gore theme ke eng a re ke polelokgolo ya ngwaga. So ke tla itšea ka mokgwa gore ke polelokgolo ya ngwaga until o mongwe wa mpotša gore theme ke eng. Theme ya rena ya World AIDS ya ngwago ke renewed effort and sustainable commitment to end AIDS. AIDS e sa le thoma ka ngwaga wa 1981. Ka 88 wa thoma taba e ya World AIDS Day. Ra e thoma ka go laeta dikerese re swarana ka matsogo re lla. Jwale ke nyaka go botša gore nako e o e fetile. A go sa le nako ya go laeta dikerese, a go sa le nako ya go swarana ka matsogo. Ke nako ya go lwa gore twatši e sepele ene re diphile ngwaga ke 2025 le hono re diphile ngwaga gore ka 2030 we must have eliminated HIV and AIDS as a public health threat. A re sa e nyaka ke nyaka go le kwišetša be a re sa e nyaka ene re nyaka gore re thušane gore re fediše twatši. Bjanong go ne le mananeo a mantši a re a hlomileng a re tlo lekang ka ona gore re ye 2030 re lwantšha tatšeng. Mara le hono ke tlo bolela ka mararo fela. Ya mathomo beke tše tharo tša go feta ke tšwa kua Mangaung go la Freistata ka hloma lenaneo le re le bitšang 6MMD ka lebaka la gore ka World AIDS Day ya ngwagola Deputy President o ile a etela ke mekgatlo e lwantšhang tatši ya HIV AIDS ba matšha ba mo fa memorandum gore ba kgopela gore re dire 6MMD. 6MMD ra gore 6 multi-month dispensing. E ra gore go ya tleliniking re go fa di-ARV a re sa go fa tša kgwedi re go fa tša 6 months. La nkwiša ke re go fa tša 6 months gore o fetše 6 months o ne le tšona gae o squata re no a ka lata dihlare be ke balwa he go be go le lehu he be ke hloka tšhelete ya go ya tleliniking he go tsena mo he ke be ke ile mašemong o di sware 6 months o di nwe letšatši ka letšatši. Re ne le mabaka a magolo a gore wa e re dira ka mokgwa. go ne selo se ba reng ke compliance ka mo medicine gore re go fa ditlhare no makala o sa fole re na gore ditlhare ga di bereke gante ko wena o sa di nweng ko wena o sa berekeng so ka 6 mmd o mollo mongwe wa go ba le di-ARV ka gae for a period of 6 months se se ra gore o ya go ya tleliniking gabedi fela ka ngwaga yo nape re thuša le gore ditleliniki di seke tša tlala ga kudu ke lenaneo la mathomo leo ke kgopela gore le le kgorameleng ba ka moka le nwang di-ARV le ka nka maatla go ya ditleliniking re e buletše 6 mmd o fitlhe gore mpheng dipilisi tša kgwedi tše e selelang ka moka lenaneo la bobedi le diboledi ka moka ba boletšeng ka tsona mo le premier boletšeng ka lona ke bona le mola go ngwadilwe gore 1.1 million close the gap campaign ke nyaka go hlatholla gore o mongwe le o mongwe wa le mo kopanong ya legolo a tsebe gore re bolela kang re nyaka go dirang mphe mmetse man gante le ka re mpona ke tlhaka lano e gakantšha mphe mmetse ao ya ya lenaneo la bobedi le tlile so ile ka ngwaga wa 2014 re le conferenceng ya AIDS kua nageng ya Australia lenaneo le lekgotla le le bitswang UNAIDS ba tla ka lenaneo lona le bitswa gore ke 95-95-95 it's like a mathematical formula le ra gore ge batho ba ba swereng ke twatši ya HIV AIDS 95% ya bona ba ka testa ba tseba maemo a bona gore out of every 100 people ba swereng ke twatši ba 95 ba testa ba tseba maemo a bona ke 95 ya mathomo eo 95 ya bobedi ra gore ge batho bao ba testileng ba hwetšwa ba le positive ge ba ka thoma go nwa di-ARV out of every 100 95 ya nwa di-ARV go ra gore re fitlhetse 95 ya bobedi 95 ya mafelelo e ra gore bao ba nwang di-ARV ge re tšea madi re ba tšea madi re testa twatši ya HIV AIDS ba sa le positive mara twatši e fase mo mading mo e leng gore ga re kgone go e hwetša le di-testi tša ka laboratory ga di kgone go e hwetša re a tseba gore motho o HIV positive mara twatši e ga re kgone go e hwetša ka mo mading a gago ka gore e fase ka maatla jwale ge o fitlhela ka mokgoo twatši e le fase mading a gago ga o sa kgona go fetetša batho ba bangwe ga o sa kgona e dula mo wena o nnoši e ka seye go motho o mongwe o robalang le yena jalo o tla be re fitlhetse 95 ya mafelelo 95 ya mafelelo e bohlokwa ka gore ge batho ba re ba bolelang ba ka sa transmitter twatšeng go ra gore bolwetši o boeme ga bo sa sepela go batho jale boeme poleke e teng go motla bo o fitlhetse selo se ba serelelang gore ke you is equal to you e ra gore undetected is equal to untransmittable because ga re kgone go hwetša twatši e mading a gago ga o kgone go e romela go batho ba bangwe ge re fihlele bakeng la mohutong re ka emelela godimo ga thaba ra begela lefase gore rena we have eliminated HIV AIDS as a public health threat jwale re tla kae mo Afrika Borwa mo lenaneong la 95-95-95 premier o le boditše nomoro tša mo Limpopo nna ke le botšatšanaga ka moka mo go 95-95-95 South Africa e tla go 96-79-94 e ra gore 96% ya batho ba leng HIV positive ba testile ba tseba maemo a bona 96% it's a big achievement iphabatele matsogo man se ke la ba le jealous how gape re šomile gore re fihle moo ya no fihla so 96% ya batho ba leng HIV positive ba tseba maemo a bona mo Afrika Borwa. Then ba ba leng treatmenting ke 79% instead of 95. Ke yona re fokolang ka yona. 79% ya batho ba neng twatsi ya HIV ba nwa ditlhare gore re sa shota. Then ya mafello 94 ira gore ba ba nwang ditlhare 94% ya bona they are virally suppressed. Aba sa kgona go fetetša motho o mongwe ka twatsi. Jwale le ka lebella re shota ka 95 ya mogare re sa tla go 79. Dipalo-palo tša rena di bontšha gore o di fihlele 95 eo go ra gore re swantse o nyaka batho ba 1.1 million re ba fe di-ARV. Ke bo mang batho ba 1.9 million bao? Ke batho ba e leng gore ba testile re a ba tseba sekela na gore re a gesa ba tlile ra ba testa re tseba le maine a bona re no tsebo gore ba kae ka gore ba lo tlala poleke ka moka re tseba le maine a bona re a tseba le gore ba testile neng ene ba positive mara ga ba no di-ARV ga bane ba no phela ga ba no di-ARV se se ra gore ba gaša twatši mo ba yang jwale re a ba nyaka ka di-25 tša February re launchitše lenaneo le re le bitša 1.1 million closing the gap campaign gore re nyake batho ba 1.1 million eo re ba fe ditlhare ba be virally suppressed. So ke nyaka gore le kwešiše taba eo ke lenaneo la bobedi. La boraro a se ra tšo re e ba le lona mara le tla ngwaga o tlang ka March goba ke April re tlo le tlhoma lona le bitšwa gore ke game changer le ya go fetola ntwa ka moka ya HIV/AIDS ya go fetoga ngwaga o tlang ya go fetoga ka mokgwa re ne le tshwana e msa ba e bitša gore ke lena Kapava yona tshwana e msa e tlang e hlabiwa ga bobedi ka ngwaga ge o e hlaba gabedi mo ngwageng twatši e ka se go sware ra go le nkwišiše fao twatši ya HIV e ka se go sware jwanong go tloga mengwaga e 44 ya go feta ditlhare ka moka tša HIV re be re di fa batho ba swereng ke twatši ka moka ga tšona dilo tša di ge re di-antiretroviral re be re di fa batho ba swereng ke twatši fela lane Kapava le yona ke antiretroviral ga re ye go e fa batho ba swereng ke twatši re ya go e fa batho ba ba seng ba swara ke twatši ra o le nkwiše gabotse. We are not going to, yes, injection ya lena Kapava is not for HIV positive people, it's for HIV negative people so that they stay negative for the rest of their lives. Yeah, they'll stay negative. So, le ka bona gore wa e tshwana e ba e bitša gore is a game changer. Jwale re kopane kgwedi tšela tša go feta re le ma-Afrika Borwa le ba dinaga tše ding tšeo thušanang le bona le ba World Health Organization le ba UNAIDS re kopane ra kwana gore tshwana e re o thoma ka go fa mang jwale re kwane ka digroup tše 4 tša batho gore number 1 bana ba basetsana ba mengwaga e 15 le bomme ba go fihla ka 24 years. In other words, adolescent young girls and young women from 15 to 24. Ke bona re yang go ba fa tshwana e ke ba mathomo ba re ba lebeletšeng ba bobedi bomme ba baimana gore ngwane o ba mo rweleng a se ka belegwa a swe twatši le bona re ya go ba hlaba tshwana e le bomme ba ba amušang ba e le gore ba tse ba belege bana ba amuša re lebeletse go ba fa tshwana e and then ba mafelelo ke batho ba re bitšang di-breaching population, sex workers, men having sex with men. So ke group tše 4 jwale ge ke eme mo pele ga lena ge ke fele ke gerula ka mola to my left wa bona bana ba le ba le mola ba apereng ditše mo tresana gore ke ditšhuniki ge ke fele ke ba gerula ka o re ngwaga o tlang re o nyaka bona bale la ba bona bale ya e sa le bannyane a se batho ba tseba bobi le bobi a se batho ba e ba le dibi wa le re itse ka mogong okay ke a fetoga ke dirile phosho ba tseba ba ne le dibi mara tše nnyane a se batho ba e ba le dibi tša o lekana le tša lena so re o nyaka bona jwale lena batswadi ke nyaka o le nthetše gabotse ngwaga o tlang ke lena le tlo re swadišang bothata le tlo gana ka bana ba ge re ba hlaba tshwana le re botse gore nna ngwana ka ga a tsebe selo ke nyaka gore le nthetše gabotse a go ne ngwana ya gago a sa tsebeng selo mokwena o sa tsebeng selo yena o a tseba yes a go ne ngwana ya gago a sa tsebeng selo ke ra gore tabeo ke e gatelela ba ba beng ba sa tsebe selo ge ba gola ke rena le lena batswadi be re sa tsebe selo ba ba tseba ba setereke ka gore yes ba tseba ka gore go robala wena ka ga gago o ipotsa gore o robetse ba ntšha ntwaneng ke ne ditaba ntwe ba bula o tla go tšale ka mofase ga diko ba re a bona ditaba fa tše šoro tše le gore wena a senko o di bone and ga a fetša go di bona o ya go di dira tsona tše a di boneng mo so sekela tlole re botsa gore bana ba tsebe selo batswadi ba lokolleng re tlo ya mo dikolong re ya go ba nyaka re le kgopelo gore le saene consent form gore ngwana ga a hlabilwe tshwane ya lena capave gore a se ka swara ke twatši please re thušeng ka gore nyaka go fediša twatšeng la mafelelo pele ke bitša deputy president ke kgopela gore banna ka moka ka mo ba eme ka maoto basadi ba dule fase please men all of you stand up ka re ra sankile emang batho ba banna bonang banna le hono ke filwe maatla ke kgonne go emiša le deputy president o ntheeditše a ema la bote gore ke maatla a maka ya ke a swere so a ke sa tloga mo stageng ka gore go ne le maatla ke emišitše le ba ka mošate banna ka moka ba eme le bana ba bašimanyana ka gore ngwana a no go tswalwa le bohloko le bana ba bašimanyana banna ba gešo a ka le emišetša go le humiliate ke le emišeditše go le kgopela diteko le dipalopalo tša rena le dilonyakišo ka moka di bontšha gore twatši ya HIV AIDS ke lena le ikitimišang mo nageng lega banna ba gešo that is a fact awa le nna ka dula fase la mpona ke eme ka gore ke monna banna ba gešo ba re twatši ye gore e tshwenye batho re tla le mabitleng ke ditiro tša rena banna it is us men ke rena re tshwenyang twatši ye re spirišang twatši ye jwale ge lena le ka tšea sephetho twatši ye ya fela a re a le thoma na goba re nee mabaka a rena ke a bomme ba ba lutšeng fase basadi ba ke bona ba bolayang ke twatši ye mara twatši ye ke timiša ke lena you run around le gaša twatši ye le gaša jwale ka peu pula e sa tsona mara e bolaya bomme ba mara ge re ya go lwantšha twatši ye bahlabani ba ntwa ba ba re thušitšeng go fihla mo di fihleng na le ya gopola gore be re ya mabitleng neng le neng bane le sa gopola ka bo 2010 le sa gopola gore be re no boloka mehle a re sa boloka batho ba re thušitšeng ke bomme ba ba dutšeng fase they were fighting how do I know ke tseba kang ka gore ka 2010 ka ngwaga 2010 re ile ra launcha the world biggest HIV counseling and testing campaign ra re testa ma-Afrika borwa ka moka after 18 months re ile ra hwetša re testile batho ba 18 million mo Afrika borwa in that 18 million 65% e be e le basadi in that 18 million ya batho ba testileng 65% e be e le basadi 5% e be bana Lina banna or rena, we're only 30%. Regasha twaji, mara regana we ilwanich. We're only 30%. Lehono, remoli nanio la 1.1 million. Kilibulisi ka le batho ba 1.1 million re a ba tseba. Dipalo tsa rena di hwetsa gore bontsi wa bona ba ba sa teng treatment ke banna. That 1.1 million ya batho ba re ba nyaka ke banna se basadi. Basadi re nyaka fiunyana ke banna le bana se batho ba ya ba le maikarabelo. Le nna lo iphitlha ka gore re a le nyaka titlisheng banna ba geshi. And ba re boditse gore go nyaka monna o nyaka go mmea di ARV mo monyaka ka lenaneo la 1.1 million. Ba re go ne mafelo a mabedi mo se wa tshwanela go we. O ka se mo hwetse monna fao. O ka se mo hwetse. Lefelo la mathomo ke tleliniki. Abae banna ba tleliniki. Abae le ge ba ba yo abae ba no ga shatwatse. Lefelo la bobedi le o ka swetseng banna ke ka gregeng. Ka gregeng mafelo a mabedi. So ba re ge re le nyaka, yes. Ba re ge re le nyaka. Re ya spotong go ba mmetsheng. Let's see ba mara le pirates. We are going to follow you. Yes, we are going to follow you. We test it now. We test yes. Lega grege ngo muchore mun. Utsena grege fi. Oh wana ki tsena grege tsena ke musadi bua gae. So basadi ba le testela. Ba le ela gregeng. Ba le apela. Ba le nwela di ARV. Le na mushumo le na kinga. What is your job? Le na banna. Ka o mo tseka mokadi ka ke basadi ba. So banna ba geshi. Let's think again. Ke a lo khupela. Ge le tloga mo leholo le ipotseng gore re joina bomme ba go lwantshwa data ya HIV gore ka 2030 e be e tsamaile. Ba mpoditse gore ba re di thetseng ke ntšhula ka la mafelo. Ba re go ka tšea banna ba ka moka mo nageng mo Afrika Borwa ka moka ga bona wa nyaka difofane tše ntši wa ba nametse wa ba romela kua ngweding wa ba notlelela kua ngweding for 10 years banna ba ka moka go šala nna fela ke nnoši le basadi ka gore no akere ke nna tona maphelo bjalo ke a go ba tlhokomela ga ntona gore bo tlo tlhokomela ke mang ka moka re le iša ngweding wa šala basadi ba re ge le bua twatše e tla be speech come. It will be gone, no HIV. All of it will be gone. Mara, Herkachia Basai, Rabaisha Welinka Moga for 10 years, Banna Bashalama. Ever say, Babu, but all of which are HIV is a Hatambal. It's a Hatambal, it's a Twelabin. So, all the indications are that we can only end this virus if men decide that we end it. And I'm inviting you today to join us. Let us end this virus with renewed effort and sustainable commitment to end HIV and AIDS. Ke a leboha. Awa. Baraka fetša modiro wa ka ke be ke wa raka gore ke tsere nako e telele gape le gono nna e be ke no lelaya ka gore ke mošomo wa ka seboledi sa letšatši le gono ke chairman ya sanako ya tseba e bang deputy president ya South Africa mošomo wa gago o mongwe e ba go tlhokomela twatši ya HIV
osomandla uzoyigcina impilo yami
president ya rena Paul Mashatile.
Uphinde ukhusele umoya wami.
Luholu utlola addressa in that capacity as a deputy president of the country and as a chairperson of SANAC. Mananeo a ka moka ke a bolelang, a ka fase ga taolo ya gagwe, the president has delegated that job to him. So ke kgopela gore le eme ka maoto. This time le basadi ba eme jwale. Le ngwana.
Ukhusele umoya wami somando zoyiphile.
Program directors, our MEC for Health, Ga-Masemola, and Provincial Civil Society Chairperson, Dr. Kulufelo Munyela. Hakitamishe Bamushate wa Ga-Masemola, kamuka habona bana le rona lehono thobela. Our gracious host, the Premier of Limpopo, Dr. Popi Ramathuba, Minister of Health, Dr. Aaron Motsoaledi, all the deputy ministers who are here, members of parliament, provincial legislatures, and all the MECs present. Salga President, Councillor Begistofile, Executive Mayor of Sekhukhune District, Councillor Mina Bahula, Mayor of Makudu Tamaga Municipality, Councillor Mera Mashatile, and all the councillors who are present here today. Chairperson of the SANAC Civil Society Forum, Mr. Solindugu, Chairperson of the SANAC Private Sector Forum, Ms. Mpumi Zikalala, the UN Resident Coordinator, Mr. Nelson Mafu, UN-AIDS Country Director, Ms. Eva Kiwango, SANAC CEO, Dr. Tembisile Kulu, patron of the Global Fund in South Africa and the fight against AIDS in children, Mayor Ga-Masemola Mashatile, all traditional leaders from near and afar who have joined us today. Ke dumedise le setjhaba ka moka sa Sekhukhune district le setjhaba sa Provincial Limpopo ka moka ha yona. Ke sa lebale to welcome Miss South Africa Disability, Miss Kapola. Esteemed guests and members of the media, we also greet you. Fellow South Africans, dumelang kaofela inhlekane, dimasiari. Good afternoon. Program directors, Every year on the 1st of December, we join the world to observe World AIDS Day, not as a mere formality, but as an opportunity to remember and strengthen our commitment to honoring lives lost. The commemoration emphasizes the importance of our commitment to accelerate our efforts to end AIDS. This year, South Africa's theme of renewed efforts and sustainable commitments to end AIDS highlights the need to revitalize strategies to improve prevention and treatment. It stresses the importance of long-term investments in HIV amid funding cuts and changing global priorities. Compatriots, efforts against HIV and AIDS have achieved notable progress, including surpassing the first and third UNAIDS 95-95-95 targets. Yet challenges persist in initiating and retaining diagnosed individuals on treatment. Currently, South Africa's statistics are at, as the Minister of Health indicated, 96, 80, 97, while global figures stands at 95, 85, 92. To confront the stubborn second 95, we launched one of the most ambitious national recovery efforts on the 25th of February this year, known as the 1.1 million Close the Gap Treatment Acceleration Campaign. That's the one Minister was explaining not long ago. This campaign is not merely about reaching numbers. It is about restoring life, reclaiming hope, and bringing our people back into a system they drifted away from for many complex reasons. The 1.1 million gap represent mothers who stopped treatment because transport was too costly, men who walked away after negative clinic experiences, young people who feared disclosure, and thousands who moved between provinces without continuing care. It represents the painful truth that success in HIV is never permanent. However, it must be defended every single day. The Close the Gap campaign is our national call to action. We call for multi-sectoral coordination to ensure that we continue to perform various community-based interventions, such as door-to-door, ward-to-ward, and district-by-district mobilizations. These strategies are essential for encouraging re-engagement in care, highlighting that treatment remains free, life-saving, and a fundamental right for citizens to improve their lives. Program directors, our progress to date shows something undeniable. When government, civil society, traditional leaders, healthcare workers, and communities work together, South Africa moves. South Africa heals. South Africa rises. Through this campaign, we are saying loudly, every person lost to care matters to us. As a country, we are also acutely aware that to achieve the second 95, we must implement policies that improve access, retention, and re-engagement with treatment. This includes policies that directly address structural inequalities and dismantle stigma, as the minister said earlier, particularly for the most vulnerable amongst us. Here I'm referring to women and girls, people who use drugs, sex workers, and the LGBTQIA+ community. By prioritizing equity and inclusion, we can create systems that protect and empower everyone. We continue to make significant improvements in HIV testing. We make improvements in treatment and care through expanded access to antiretroviral therapy and innovative community-led efforts. 3 weeks ago, our health minister, Dr. Aaron Motsoaledi, launched the 6 MMD. In other words, 6-month, multi-month dispensing. This was done in Bloemfontein. This approach allows stable patients to receive a 6-month supply of ARVs in one clinic visit, reducing clinic visits, saving time and transportation costs, and alleviating the workload at healthcare facilities. The result will improve treatment adherence and patients' outcome, contributing to achieving the second 95 target. Compatriots, South Africa faces a dual epidemic of HIV and tuberculosis. The Global Tuberculosis Report of the World Health Organization of 2025, released last month, shows that tuberculosis continues to be the world's top infectious killer disease. In 2024, tuberculosis claimed the lives of 1.2 million individuals worldwide, with 54,000 fatalities in South Africa alone. Despite a 61% reduction in tuberculosis incidence in South Africa from 2015 to 2024, the struggle against the disease continues. We need to end TB. In line with this objective, on March 24 this year, during the World TB commemorative event in KwaZulu-Natal, I launched the End TB campaign with the goal of testing 5 million individuals annually for tuberculosis, highlighting the urgency of combating the disease for its eradication. Subsequently, Minister of Health, Dr. Motsoaledi, launched the TB dashboard to allow stakeholders to monitor the campaign's progress by having access to near real-time data. To date, this campaign has reached 1.8 million people, representing 62% of the target assigned from April the 1st to September the 30th of this year. The National Department of Health has introduced a novel 6-month regimen for patients with multi-drug resistant tuberculosis, significantly shorter than the previous treatments of 9, 18, or 24 months. This new regimen has achieved an unprecedented treatment success of close to 80%, surpassing the target of 75% of drug-resistant TB patients. We are performing well against national and global targets. Another shorter, much more friendly treatment regimen of 4 months was also introduced for children. We look forward to further refinements in treatment outcomes amongst specifically children receiving newer TB treatments in our health facilities. Fellow South Africans, 2025 marks 2 decades since the introduction of life-saving antiretroviral therapy, ARVs. Prior to this policy shift in the early 2000s, HIV was a fatal disease with significant mortality, affecting over 500,000 lives and reducing life expectancy to just 54 years. The introduction of ARVs transformed this narrative, starting with the first pill administered in Khayelitsha in Cape Town, heralding a miraculous change. Mothers initially given a terminal diagnosis have experienced health improvements, witnessing their children graduate and becoming grandmothers. Children thought unlikely to reach grade 1 are now thriving at 21, flourishing in tertiary education. ARVs have reduced vertical transmission of HIV to below 2% in South Africa, allowing children born to HIV-positive mothers to achieve healthy milestones. And this is what Ubuntu means when it becomes policy. Fellow South Africans, we hold this commemoration against the backdrop of a successful G20 summit. One of the key activities on the sidelines of the G20 was the Global Fund Aid Replenishment Summit. The event was co-hosted by South Africa and the United Kingdom, led by His Excellency President Cyril Ramaphosa and His Excellency Prime Minister Keir Starmer of the United Kingdom. The 8th replenishment campaigns aim to raise a total of $18 billion to fund the GC8 grant cycle from 2027 to 2029. The objective is to save up to 23 million lives, enhance health systems, and accelerate efforts against HIV, TB, and malaria. Pledges amounting to $11.3 billion were raised globally, with significant contributions from the African continent, the largest recipient of the Global Fund resources. South Africa pledged $36.6 million through a public-private partnership between DERCO National Department of Health, Anglo-American, and Goodbye Malaria. South Africa has been a major beneficiary of the Global Fund to the tune of $2.3 billion over the years. Most recently, it secured $400 million for Grant Cycle 7, which started on the 1st of October this year and will run until the 31st of March 2028. On this World AIDS Day, we celebrate the incredible progress that has transformed HIV from a death sentence into a condition that can be managed with dignity and hope. Yet our mission is far from over. Today we stand at a defining moment where science, compassion, and unwavering resolve can unite to end an epidemic that has cast its shadow for many years. We are on the verge of a significant advancement in the prevention revolution. Lenacapavir is a groundbreaking long-acting prevention technology that provides 100% protection for up to 6 months with just 1 injection and requires only 2 injections per year, which will significantly enhance how individuals protect themselves in the next generation. This innovation has profound implications for South Africa. It offers hope for young women who cannot negotiate condom use. It empowers adults and girls navigating relationships marked by power imbalances. It provides protection for key populations who face stigma and discrimination. It supports workers and learners who struggle with the burden of daily pill adherence. In other words, Lenacapavir speaks to the reality of our people's lives, that preventions must be practical, dignified, discreet, and compatible with the pressures of daily life. We collaborated with SAPRA to achieve regulatory readiness, making our regulator the first in Africa and third globally to register Lenacapavir. Additionally, we are engaging with various stakeholders to explore local manufacturing opportunities, emphasizing the importance of active participation in developing prevention tools to avoid relying on global supply chains. Program directors, let me be clear. We cannot repeat the mistakes of the early ARV era, where life-saving tools reached our shores too slowly. This time, we move with agency, with foresight, and with unity. Lenacapavir is not just a drug. It is a symbol of what becomes possible when science, political will, and community demand meet at the same table. To close the 1.1 million gap and prepare for long-active prevention, we must critically examine our efforts towards marginalized communities and our willingness to embrace new scientific advancements. Key considerations include ensuring accessibility, affordability, and sustainability, alongside a commitment to a future without HIV transmission at birth or resulting adult death from the virus. As I conclude, program directors, let us confront stigma with courage. Let us ensure that we fund research and ensure that treatment reaches everyone. This is a commitment to health, to dignity, to justice, and equality for all people. Let us rise to this challenge together, renewed, resilient, and resolute, aligned to South Africa's World AIDS theme for 2025, which is renewed efforts and sustainable commitments to end AIDS. With those few words, I would like to thank everyone and make sure that we continue this fight together. Akensa inkomo.
Re a leboga molaetša o mobotse wa letšatši la lehono wa go tšwa go Deputy President wa rena. Re leboge le setšhaba ka moka gore ka nnete le kadimile ditsebe la theeletša molaetša o bohlokwa-hlokwa o ba re fileng ona. Ke boletše ka re di-item tšele tša rena tša entertainment di tlatla ka morago ga dipolelo. Ke tla kgopela Dr. Mnyela e tla ka mo pele o tle o bitše di-item tšeo di swereng before re tlo bitša our executive mayor gore a tla kgone go fa a vote of thanks, re tla kgopela those items. Dr. KG.
Okay, thanks very much, Honorable MAC. Before we reach out those items, we just want to take this opportunity and make emphasis on some of the things that were mentioned here as the Civil Society Forum, just to put it in a progressive mode, that we have recognized, Honorable MAC, that there's an acknowledgement in terms of rolling out the 6th MMD in this province that has been long overdue. And we're also saying let's couple the treatment that we encourage people to take with nutrition, making sure that we supply to our people, particularly those that are living with HIV, and then making sure also that we collaborate our programs with the IDP that are always floating in our own communities, and making sure that we integrate our HIV/AIDS program. So those are some of the key things that we also want to encourage. And also, a minister, to say, to avoid this thing of mental health and also GBV, we also advocate that let's stop this thing of saying employment is 35 years and below. Because when coming to the issue of HIV and AIDS, it doesn't choose whether you are 35 years or what. It attacks everyone, and you don't have anything to rely on, apart from us encouraging you that you should take treatment, but you don't have anything that you rely on as an individual. So we're advocating for that to fade and encourage that employment should then be given to everyone in the country, irrespective of age. Comrades, we are also progressing on this movement in making sure that as the civil society, we are saying, let us avoid a situation where we always take everything that belongs to the people, but we have to fight and take everything to the street. Let's just allow ourselves to bring service delivery that is pure and it's due to people in our own community, and we'll avoid all these things. So by so saying, we're also submitting to that, to our government, in making sure that we become progressive to such kind of issues. Thank you so much. We would want to see our group performing, but then before we call upon the groups, we want to close the program. Remember, we outlined that there's also an engagement from our minister and also Deputy President from the NEC. So we'll also make sure that we run through the program so that they are excused, and then have the formal program being closed officially. Then the rest of the items will then be attended to. However, we're going to prioritize that they leave, then we continue with the program, particularly in the issue of entertainment. MEC.
No, thank you very much. As Dr. Muyela has said, we'll continue with the activities now. Let us move to the item, vote of thanks. Ritlobija mo Marorena wa mo Sekhukhune. Ritlobija our executive mayor. Murali Adiatabirwa Marunoa. Or atle mo pele, atle refa vote of thanks. Aramureleng, Marorena, Musadira Rabasadi, community way! Community way! Community way!
Ala, let's Sekhukhune, ala. Ala, let's Sekhukhune, ala. Batsamaishi ba lenaneo. Lena ake hlabeng ka diloka pele Deputy President a sepela. Viva Deputy President, viva! Viva Deputy President, viva! Viva Deputy President, viva! Viva Paul Mashatile, viva! Viva Paul Mashatile, viva! Akere walo la tsebo re mo ke bopedi bo kopane ake tse sebaka se ka ntle le go television lenaneo ke gopetse gore ke feletse modiro wa ka metsotso e meraro ke rata go tse sebaka se ke hlomphe protocol e setting ya rilwe mo Deputy President Ntate Mashatile le mme wa rona Minister wa rena Phahle, Premier ya rena Mmago Diphetogo. Ke bona le hono o tlile le bo malekgotla petition mo. Malekgotla petition. Rata o tja sebaka se re le rome go mo Premier gore le mo leboge. Gore lagato la Sekhukhune re kwa re itumetse go tja ke to mogolo. A o tšha mo seleteng sa borena sa Sekhukhune. Re leboga mma rena MEC Deputy Chair Comrade Florence Ratzilane o gona le ena mo ke ba leboga ka moka Provincial Treasurer Comrade Nakedi Sibanda ke kana mme Mabungulu le Ramakhanya wa tša thuto mma rena Violet Mathelena ra mo leboga Sebata o lo phakane a hlabirwa phakane MEC wa dikgerekgere former regional secretary Ntate Maseko ra leboga o tamishe moreki ka mo Ntate Khabu Mahwai MEC wa tša matsebetsebe wa Provincial Limpopo ka mokana ga lena ba le go gona mo ba etile pele ke hunadi wa Phahle mmera wa rena wa Makhudutamaga halala unadi halala mara Deputy President a kola itse gore ke mo a ke tsamaye ke noši ke na le maitsa ga shumola di mera tša mo Sekhukhune ba eteletšwe pele ke Comrade Tladi mera wa Elas Mtswaledi mera wa Feta Khomutubazi Deputy Secretary wa rena African National Congress treasurer ya rena Ntate Moimane ka moka le di speakera tša mo seleteng ka moka ba gona mo ke a ba bona mošate wa gaetšo wa Ga-Masemola wa Kgoši Mahlako a Ngwato ba le re dumeletšeng gore re tle re tiša monyanya o mokaka mo gomme la re dumella gore re tle mo mobung wa lena. Rata go tšea sebaka se gore legato la mmagorena le fihle ka gae le moleboge gore le ka moso ga nke a re šaetša batau ra leboga setšhaba ka moka se se leng gona mo ba ka moka ba bileng gona. Mrs wa rena wa ba ba seng ba itekanela, Miss South Africa Disability, o tšwa mo Limpopo, o tšwa mo Limpopo, o tšwa mo Sekhukhune kae, o tšwa bopedi gare Makhudutamaga kae wa 20 ya Makhudutamaga halala botšetša kgapola halala. Ba tšea karolo ka moka nka re ya phošo a nka lebala lešhaba le le tlileng mo legatong la setšhaba go tla go tšea molaetša o bohlokwa-hlokwa wa maphelo a rena. Ke rata go tšea sebaka se ke le leboge setšhaba sa Sekhukhune le rile batho. Ke kwele o mongwe a re ba re stadium a sa tlala, ke re banna motho a se ka tla a re nyatša. Rena re bontšhitše capacity go tloga le maloba go na le Provincial Legislature Sekhukhune le ngwaga o tlang premier re ka se o tshwene re kgopela gore o tšiše State of the Province address mo batho ba Sekhukhune ba go kwa diswikiri. Re leboge mošomo mo botsebotse o le o rileng le sware setšhaba se sa di-province tše dingwe ba re etetše go fa ka lerato le balaetše gore bopedi a re ngapane ra ratana gomme re tšea gore melaetša e fihlileng mo ya bongaka Motsoaledi mo seleteng sa gabo re tla tšwela pele go uauetša gore bolwetši jo le jona bo santše gore bo hlabiwe ke dihlong bo fele bo se ka hlo bo e ba gona go banna ba ba botse ba ba lego ka mo tenteng. Ke re halala banna ba rena ba ba botse, halala banna ba rena ba ba botse ba go rata basadi, halala. Aowa ke banna ba Sekhukhune o bona gore ke ba ba botse ba go rata basadi. Legato la Sekhukhune district municipality le dimasepala tša rena Elias Motsoaledi, Ephraim Mogale, Makhudutamaga ga mmogo le feta go motubatse rata go tšea sebaka se re le rete re le ka moso. Ke a leboga.
Re le leboge re rata go tšea sebaka se go leboga perekišano re berekile gabotse re fihlile mafelelong a program ya rena executive mayor re lebogetše go lena ka moka ba leng gona fa Dr. KG o tlo no fa di-announcement tša gore re tloga mo re ya kae gomme re rata go le leboga gore le kgonne go berekišana le rena gabotse go fihla mafelelong.
Thanks very much, Honorable MEC. And then Akere Mayara was speaking about people who are coming from Executive Mayor. You forgot to mention that coincidentally, people who are running programs, they are also from Sekhukhune. So, yeah, we are taking the lead. And from Elias Motsoaledi also. Thank you so much. This is just announcement that we're going to have. People who came with buses, that's number one. People who came with buses, your food are in the buses. You don't have to queue or go anywhere. You just only go to your buses. That's where your food will be. Dignitaries, you're going to be served at Parosana.